Drug classifications and how they affect your driving. Part 1. The dangers of drug usage and how particular substances will impair your ability to drive are topics covered in the following modules. There are countless different medications, each of which affects the body's systems differently due to its unique chemical composition. 3 categories best describe how most medications are used. 1. Stimulants accelerate the body. 2. Antidepressants slow down the body. 3. Hallucinogens change perception and thinking. You can get a broad notion of how a chemical will impact your body and mind if you know which group it belongs to. It is important to keep in mind that a few substances may fall into more than one of the 3 categories of stimulant, depressant, or hallucinogen. Drugs from each of these categories have a wide range of immediate effects, some of which are helpful for managing symptoms and treating illnesses. Others are clearly less advantageous, such paranoia and hallucinations. The long-term effects of drug use can include permanent disability, death, and diseases of the heart, lungs, liver, and brain, as well as digestive disorders, decreased libido, mental health problems, and mental decline. Any substance, whether it's legal or not, can make you unfit to operate a motor vehicle. It is your job to make sure that when driving you are alert, focused, and physically able to manage your vehicle. Even if the medicine in question is your prescribed pain medication, a law enforcement officer may charge you with DWI, driving while intoxicated, or DUI, driving under the influence, if they think it is affecting your ability to drive. What exactly are drugs? Narcotics is a word you may also hear in reference to drugs. Any medication that dulls the senses, lowers pain, or induces sleepiness is referred to as a narcotic in the medical field. This term may be applied to substances like opioids, barbiturates, and other widely used painkillers. Narcotics have a great potential for abuse and are exceedingly addicting. Some of the most harmful and widely abused drugs include opium, morphine, codeine, and heroin. Memory loss, drowsiness, nausea, shallow breathing, and abnormal heart rate can all be side effects of drug abuse. While narcotic medicines are routinely prescribed as painkillers, it's vital to understand that this does not make them any safer than opiates and other related illegal drugs. Drug overdoses resulted in 43,982 fatalities in the United States in 2013. Among those who died, prescription medicines contributed to 22,767 deaths. 16,235 of them involved narcotic painkillers. In the context of law enforcement, the term narcotics can refer to any drug or substance included by the Controlled Substances Act, including marijuana, cocaine, LSD, and methamphetamine. Any chemical that might be considered a stimulant will accelerate and enhance your body's natural processes. Acute alertness, increased energy, a quick increase in heart rate and breathing, and appetite loss are just a few of the short-term effects of stimulants. Because stimulant medicines activate the dopamine pathways in the brain, they can also produce a relatively brief feeling of intense euphoria and well-being. Here are a few popular stimulant medications. Nicotine, the highly addictive, mind-altering substance in tobacco. Cocaine. Ritalin. Amphetamines like Adderall. MDMA, ecstasy. Methamphetamine. Although it is extremely hazardous, nicotine is perhaps the most often used stimulant and is legal. Very tiny doses of nicotine may ease pain and reduce anxiety. Shortly after the medicine wears off, these effects are replaced with heightened anxiety and increased pain sensitivity. Although the aforementioned short-term consequences seem favorable, they are actually very harmful. The vital systems in your body are unable to function that swiftly for an extended period of time. Stimulants may result in 1. Massive anxiety. 2. Being unable to focus on a single task. 3. Muscular coordination issues. 4. Tremors or muscle trembling. 5. Enthusiasm that is too much and an inability to relax. 6. The incapacity to perceive danger or assess risk. 7. Heart failure and heart attacks. 8. Potentially harmfully high body temperature. We don't need to think about these impacts in great detail to see how detrimental they would be to your ability to drive.